Hello everyone, myself Dr.Suhaas Khaire. I work at Zen Multispecialty Hospital Chembur, Mumbai. Worldwide, January month is celebrated as Thyroid Awareness Month. If we see, all we know about the thyroid gland, but we may not aware about the thyroid related symptoms. So this month is dedicated to talk about thyroid gland, to know the symptoms of thyroid gland and its treatment. So today I will be discussing about a few important disorders about thyroid gland. The most common thyroid disorder is hypothyroidism. The patient usually presents with lack of energy. They may feel excessive fatigue. In females particularly, we see the menstrual irregularities. And some patients just feel they are not feeling good at all. So we need a very high index of suspicion. The treatment is very simple for hypothyroidism. We just need to replace the thyroid hormone, and periodically we should visit your doctor. The next important disorder is hyperthyroidism. The Graves' disease is a prototype for hyperthyroidism disorders. If you look at the symptoms for hyperthyroidism, these patients, they present with loss of excessive weight. They have lot of tremors in the hand. They feel palpitations. Sometimes some anxiety-like symptoms they are there. To diagnose this patient, we need specific tests. We sometimes need some imaging also and few blood tests. The treatment we need under endocrinologist for this disorder. Also, there are other disorders like thyroid cancer or thyroid nodules. The diagnosis of these disorders and the investigations also we may need some imaging, sometimes the fine needle aspiration from these nodules, and we just need to know these are the benign disorders or the cancerous one. So I think all we know about these thyroid disorders, symptoms, but we may not go out to the doctor and just get investigated. So I feel if you really feel that you are having all of the any of the above described disorders, or if you feel any of the symptoms about thyroid gland, just go to your endocrinologist and get yourself tested and treated. So now we'll go towards some myths and facts about thyroid gland. So most common myth about thyroid gland, it is a disease restricted to only females, but it is not the only females disease. It can affect to all age groups. Next common myth is is about the foods that should be restricted for the patients of thyroid disorders. But latest evidence says there are no food that causes the problems for thyroid or which should be restricted in thyroid gland. So there are no food restrictions as such. Also, some myths are like if I have a lump or a nodule in a thyroid, it is always a cancer, but this is not so. Most of the thyroid nodules or lump, they are a benign one. We just need some investigations. Also, the myth which is common, if I have a thyroid cancer, if I diagnose with a thyroid cancer, that is a deadly or a lethal. Definitely cancers are bad, but thyroid cancer is one of the good cancer we can say, because if we diagnose early and if we give the proper treatment, they are absolutely curable and the patient leads a normal life. So I think thank you very much for the kind listening.